At St Michael's, we're passionate about giving women informed choices. So we've created this short film to give you some more information about having an epidural during the birth of your baby. Many women choose to use simple forms of pain relief during labour, such as taking a warm bath, pain-killing tablets, or gas and air. However, if you're still uncomfortable, you may wish to consider having an epidural. Epidurals are an effective method of pain relief. There may be reasons why an epidural might not be appropriate for you. The My Pregnancy at St Michael's app can tell you about the choices available and the risks and benefits of each one. Your community midwife will also be able to answer many of the questions you might have. Epidurals are available at any time, but only on the central delivery suite. If you're labouring at home or on the midwifery-led unit and decide that you want to have an epidural, you'll be transferred to labour ward so you can receive it. If you choose to have an epidural, your midwife will give you an information sheet to read. Your epidural will be inserted by an anaesthetic doctor who specialises in providing complex pain relief. Although there is an anaesthetist assigned to labour ward at all times, there may be a delay if it is very busy. As soon as they are able, they'll join you in your room. They will review your medical and pregnancy history, ask you about any medications you might be taking, confirm your allergy status, and might examine you. They'll recap the risks and benefits of having an epidural and answer any questions you or your partner might have. Epidurals are very safe, but it is important to know about the small chance of problems. Sometimes epidurals are not completely effective at taking away all the pain of labour. If this happens, there are several options, including siting the epidural again. Sometimes epidurals cause your blood pressure to drop or can make you feel itchy or sick. These can be treated. Uncommonly, women get a bad headache after an epidural. This can go away in a few days with basic painkillers, but sometimes requires further treatment. Damage to a nerve causing a numb patch on your leg or a weak leg is rare and is usually temporary, and the risk of bleeding within the back or causing an infection is very rare. Backache is a frequent concern of women requesting epidurals. Now, backache is very common during pregnancy and often continues after delivery of the baby, but this is very unlikely to be caused by the epidural. Some women are understandably worried about the risk of paralysis, but be assured this is extremely rare. Having an epidural can limit some women's ability to push, so there is a slightly higher chance of needing assistance with the baby's birth with a suction cap or forceps. However, choosing an epidural does not increase your risk of a caesarean birth. Before the anaesthetist places your epidural, a small plastic tube or cannula will be placed into a vein in your hand or arm so that fluids and medications can be given if required. Next, you'll need to get into position so the anaesthetic doctor can insert the epidural. This can be done with you sat up or lying on your side. In either position, you need to put your chin onto your chest, relax your shoulders, and curl up over your bump. It also helps if you can push your lower back out, as this opens the spaces between the bones on your back so that it is quicker and easier to place the epidural. The anaesthetic doctor will clean your back with an antiseptic solution and will then apply a sterile drape to keep the area clean. Next, they inject some local anaesthetic to numb the area. This might sting a little at first, but after this you should only feel the sensation of pressure whilst a thin plastic tube called an epidural catheter is inserted through a special needle. Sometimes you'll feel a strange sensation in your back or down one of your legs. Don't worry, this is normal. Just let the anaesthetist know if this occurs. It is important to stay as still as possible during the procedure. If you have a contraction, let the anaesthetist know and they'll stop what they're doing. As soon as the contraction wears off, inform the anaesthetist so they can continue inserting your epidural. Once the epidural is in place, it will be taped to your back and over one shoulder. You'll then be able to roll onto your back, sit up, and get yourself more comfortable. It takes about 20 minutes to safely set up and insert the epidural, and it takes 15 to 20 minutes for an epidural dose to take full effect. Sometimes an additional injection in the back called a spinal anaesthetic will be offered. This usually works within 5 to 10 minutes. The anaesthetist will give you a small dose of the epidural medicine to confirm it is working as expected, and your blood pressure will be checked quite frequently at first. Your anaesthetist will connect your epidural to a special pump, which has a button you can press to give yourself a dose of the epidural medicine whenever you need it. Your anaesthetist will show you how this works and get you comfortable. You should press the button once your contractions start to feel uncomfortable again. Don't worry. The pump has safety features that mean you cannot overdose. Once you press the button and the medicine has been delivered, you cannot receive another dose for 15 minutes. With the epidural pump, you will be in control of how much medicine you receive. Ideally, you should aim to keep yourself comfortable but still aware of your contractions, so that when it comes time to push, you're able to work with your body and deliver your baby. With frequent epidural doses, it is possible that your legs become a little bit heavy, and you may not be able to move around or push as effectively as normal. Your anaesthetic doctor and midwife will make periodic checks on how well the epidural is working by using a cold spray. The epidural may take away the feeling that you need to empty your bladder, so your midwife will check to make sure you can pass urine regularly. A small tube called a catheter may need to be inserted temporarily to empty your bladder. However, with a working epidural, this is not uncomfortable. It may be possible for you to adopt different positions in the bed, or even walk carefully around the birthing room after your epidural. This is called a mobile epidural, and your midwife will be able to advise you if this is a suitable option for you. We discourage women from eating whilst using an epidural. However, you should continue to drink. We recommend isotonic sports drinks to help keep your energy levels up for your baby's birth. You'll be given regular tablets to help reduce the acid in your stomach, and after you have had an epidural, we'll monitor your baby's heart rate using a sensor which is strapped to your bump. Ordinarily, you'll be encouraged to use the epidural right up until your baby's birth. After your baby is born, the epidural tube is simply pulled out by your anaesthetist or midwife. You'll be advised to stay in bed until your legs feel strong enough again to support you. An anaesthetist will visit you on the postnatal ward the next day to make sure all its effects have worn off completely. If you choose to breastfeed your baby, it is perfectly safe to do so after an epidural. Thank you for taking the time to watch this video. We hope it will help you feel better prepared if you decide to have an epidural during your labour. And we look forward to welcoming you at St Michael's Hospital on the day of your baby's birth.